Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. And I'm joined today, as always, by my very haunted co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Ooh, can you make Dr. Martin the Headless Horseman? Oh, man. That was always like the creepiest cartoon that would come on around Halloween, the Headless Horseman. Like, I was so creeped out by that. We'll see.
So do you want him without a head or the pumpkin head? Which one is it?
I'll take the pumpkin.
He was holding he was always holding,
his
the pumpkin.
Here we go.
Yeah.
Here we go.
You're holding your own head? Well, that's even worse. Not liking that at all.
We'll see how that goes.
Yeah.
Just use AI. Come on. We just talked about it.
Yes. Well, if you are listening to this episode and you would like to watch it, you can find that on YouTube at Jason Martin MD. We are also at Beauty and Surgeon Podcast, wherever you listen to podcasts. This is part 2 of our listener questions and comments. If you would like to be featured on the next listener questions and comments, you have to leave us a question or a comment in the description or in the box below, or you can send me a text or leave me a voicemail at 303-630-9038. Without further ado, should we jump right back in?
Let's go.
Okay.
Part 1 was great. Let's try part 2.
So we are back to talk about thigh lifts. You're seeing a theme here.
Oh, yeah.
This is continuing over from part 1. This is from Sarah's Randoms.
I kind of like it.
Randoms.
Sarah's Randoms. That could go a lot of different directions.
Episode 158, Everything You Need to Know About Thigh Lifts, Part 1.
You think it was a bad weekend? Never mind.
I don't know what that means.
Okay, that's okay. That's okay. Yeah. It's okay. Yeah. Amy and I have humor at different levels of maturity.
Well,
okay,
I don't always understand your pop culture references.
No. She had randoms over the weekend. It's okay. Let's keep going.
Oh, yeah.
Okay.
I was thinking more of the Sarah part.
Yeah.
Why isn't anyone talking about this damn swelling, which I hear doesn't go away until 12 months post-op? This is insane.
Yeah.
You are experiencing swell hell, Sarah.
Swell hell, yeah. We talked about that. First one was in the Facebook group out of California. I think they coined the term swell hell,
For tummy tucks,
according to that patient.
Yep. But swell hell can exist after all surgeries, and thigh lifts are definitely one that it can.
Right. Anything that's dependent, a lot of surface area, you elevate it for sure.
Yeah. It can take, it's in our body lift episode. We actually read a special note from the plastic surgeon from the board that was talking about 2 years for full recovery from a body lift.
So one of the things that Amy referred to, I think it was in the last episode, where she says sometimes people don't realize you cut through the lymphatics, and you definitely do in these surgeries. And that lymphatics is what gets that swelling and edema fluid out. It usually goes up to the lymph node basins, which in the lower extremity, upper lower extremity, goes into the groin, and you make an incision right through there. You don't cut into the deeper layers where that lymphatics are, but you do cut through some of them. So you're going to be somewhat limited to get rid of that swelling fluid quickly. Also, you're in a dependent position. You stand more than not. You're never sleeping upside down like a vampire. So you're not gonna. It's hard. It's hard to get rid of that swelling fluid. I mean,
you'd make a good vampire.
Oh, great.
With the big collar, like Count Dracula style vampire.
What was the 50s actor that I looked like? Not Doctor Strange.
Oh, I don't even remember. Yeah, that was a rant. That one, that's going way back.
That was going way back.
Yeah.
I don't remember what episode that is. Here, this episode.
No, it cannot be found. I don't even know which one that one was.
Come on, Nels. This one here.
Yeah. But that's a good point. I mean, the point of this, we talk a lot about sitting in part 1 of our questions from listeners after a thigh lift, and depending on the type of thigh lift you have, you may not be sitting much. So that that constant standing, the constant leaning, you're not really sitting down, you're not really flexing that joint as much to kind of push it back up.
And you may not be walking a lot because it hurts to walk. Yeah. And walking stimulates the lymphatics because when your blood flows, the lymphatics flow. So it's
walking limited.
Kind of perfect storm.
Yeah, like you're doing a weird walk. The soleus, we actually call the heart of the leg, or the soleus and the gastroc, which are the 2 muscles of the calf, because that's what pumps blood and lymphatic fluid back up.
Is this from Darwin? Is this from Darwin?
This is literally from Anatomy 101.
No, Darwin, your massage teacher.
Yeah, he was the
one who talked about the key clefting area of the butt. Don't lose your keys down there.
No, he was the crack is not a handle.
Oh, not a handle. Yeah.
Yes, you do not grab it. Yeah, he wasn't using his keys. No, this is not a Darwin thing. This is my professor in anatomy was actually named Colt. Darwin was sports massage.
Who are these people that taught you? It's so funny.
Colt was he was an embryologist, like, so he loved drawing. Haven't I ever told you this? He would always draw the fetus. He calls it Festus the fetus, because he would always talk about the fins and like where like our gills turned into our latissimus muscle, and like Yeah. No, but I'm boring you guys. Okay. Either way, swelling. Let's get back to swelling.
I like the Darwin stories better.
Yeah. The crack is not a handle.
Yeah.
But yeah, it's true, Sarah, unfortunately. And we do talk about this a lot on our episodes. And you can definitely have swelling that lingers for up to a year, for sure.
Acupuncture, lymphatic massage, hyperbaric, walking.
Yeah.
Lifestyle, hydration, nutrition,
electrolytes.
Yeah.
Making sure your electrolyte balance is in check. I mean, that's something. We had a patient who had some swelling in their lower extremities after a tummy tuck, and I had them start doing a specific electrolyte that I had them pick up, and like it did help a lot. Like those things can get out of balance really quickly when you're swollen too. Like your electrolyte balance can get off.
So when I was climbing the 14er, again, this is such a dumb Colorado story. I got almost to the top, and then both of my thighs, my quads started spasming.
Oh, you were cramping.
Well, I'd done a leg
Sodium.
day the day before like an idiot.
Mm-hmm.
But so the
you needed some element.
I took it 30 seconds.
Yep.
I am not joking. 30 seconds. The spasm stopped.
Yep.
And I was like, this is science in action, even though I was miserable at that point. I was like, why am I doing this? This was science in action.
Yeah.
30 seconds.
It works. It's like starting an IV on somebody. Like
so crazy.
Yeah. Oh, element works. Yes. So people tend to avoid salt after surgery. So because they think it's going to make them swell more, but that can ultimately end up causing issues with electrolyte balance. So talk to your doctor about it. There might be some things you can do to make it better, but it's not abnormal. We're normal people here.
Right.
Listen to episode
You're not
200.
insane, Sarah Randoms.
Yes. All right. This was from part 2 of the same series, episode 159, Everything You Need to Know About Thigh Lifts Part 2. This is from Cindy Lou Thomas. She asked what support pillows are recommended. So you can't do Amazon links in YouTube comments. So I'm going to have Nils put it in the description of this episode, the link to the pillow system. But I'm always happy. I just told her, I'm like, Cindy, I can't link it, but search for these exact words on Amazon and you'll find it. So if you want it, shoot me a text. I will text you the link, or you can find it in the description box. All right. On to arm lifts. So this is from AJ. This is from our YouTube short, Arm Lift Options and Alternative Treatments.
Yes.
Which is stronger and provide more skin tightening? Renuvion, J-Plasma, which is the same thing, or BodyTite?
Per the data, BodyTite has more skin tightening than Renuvion.
Specifically for the arms.
Yeah.
Yep. Absolutely.
There's actually a study that I've referred to this before, that actually the people that I train with and some of my colleagues did. And they did ultraviolet tattooing on the arm. They did before and after BodyTite. And then they did it in a triangle shape, and they showed the contraction of the triangle. And that's how they got the percentage of skin tightening.
Yeah, really
which
cool.
I found very interesting. So, I mean, obviously there's liposuction involved there too. These were people that didn't have huge arms, so the liposuction was not contributing as much. And what they found is that BodyTite does really cause skin contraction, but so does very superficial aggressive liposuction, which can be very problematic in the arms. That's what I do. Yeah, because if you make a mistake, it can cause notching and contour deformities.
Yeah. So
again, other people love Renuvion, J-Plasma. It's ionized helium gas that's ignited. So we're not as impressed. Doesn't mean it doesn't work. Doesn't mean people don't do it well. The problem with the arms is you put ionized helium gas in the arm. What has happened, one of the reasons they got taken off the market for a while, is that gas tracked from the arm underneath the skin up to this woman's neck and almost incapacitated her. I don't think she died, but it was a surgical or a medical emergency. So that can happen if you over inject the gas into there. So
we like BodyTite.
We like BodyTite.
Yep.
It's FDA approved.
Exactly. We like BodyTite.
For
a reason.
For a reason, yeah.
So from the same short, this one is from Kimberly. How soon after surgery can you start treating the scars with things like microneedling, laser, etc.?
That's all you aim.
So this is a great question. And we talk a lot about this on our episode about scars, which Nils will link.
Here.
Yep. So it depends on how your scar heals. And this is where you should absolutely only do this with the advice of your surgeon. Typically, in most cases, anywhere from 4 to 8 weeks is when you're going to be able to start some of these more invasive treatments on the scar itself, like microneedling and lasering. Some doctors may let you start earlier, depends on how your scar is healing. the issue with doing something that too soon is you want to allow that inflammatory process to kind of go through its steps, the remodeling.
Which is like 3 or 4 weeks.
Yeah.
Now there's a long-term remodeling, but 3 to 4 weeks to really get to substantial collagen deposition.
Yeah. And to let the scar be healed.
Right. And then it remodels to up to 6 months.
Yeah.
So really when you do these lasering
year.
treatments and needling and stuff, you're really trying to affect the remodeling part. Because at first the collagen gets set down like Lincoln logs that are
pickup sticks
that are thrown on the ground, and then it starts to organize itself and become parallel.
Yeah.
And that's when a scar that looked like aggressive and then kind of contracts and smooths down and then slowly goes away.
Yeah. There are other topical things you could probably do in the meantime, again, with your surgeon's recommendation, but we, have recommendations for our patients for either recovery like silver gel, maybe some topical oil that's helpful, or even scar silicone, but definitely talk to your surgeon about those before you start doing them.
Mm-hmm.
Because if your scars are healing slowly, they may want you to wait longer. If they heal really fast, you may be able to start them early.
Right.
Just depends.
Let's go.
Yeah. All right. Still from the same YouTube short. This was a popular one the last couple months.
Zara Music.
Zara Music.
Yeah.
Does the mini also scar the back of the arms, or is it just in the armpit? I have seen photos of uneven skin texture online.
Yeah. So most of the time when you're doing a mini brachioplasty, you need a full. You're trying to like squeeze it in. So you think about it like chasing out extra skin. If you're going to chase it out along the length of your arm, it's easy because that's pretty long. But when you try to, chase it out all into the armpit, there's only where, to chase it out, meaning to release and remove all that skin and inset it. You can only go to behind the arm or in front of the arm. And you don't want to go in front of the arm because people with their arms down, if you look in our YouTube channel, you would see this scar that runs up in front of, like on the side of your shoulder.
You also see it on the back.
But you can see it on the back too, but that's obviously more preferable. So most people are going to chase backwards than forwards.
But we talked about this on our longer episodes about arm lifts. We don't put the scar on the back of the arm. We put it on the inside of the arm in the brachial curve or in the brachial groove.
Yeah, right here.
Yeah, here.
Yeah.
So, but we have seen it. We actually have a patient who had a brachioplasty.
So you're talking about a full. He's talking about a mini, but that's okay.
She. Yeah.
Zara. Sorry.
Well, either way, my point being, even if you extend it, we don't extend it down the back of the arm.
What they were talking about with the mini, if you extend it,
they're talking about like onto the back of the back.
The back of the back, like basically where the shoulder meets the back.
Right.
That's what they're talking about.
Yes.
And I mean, if you have a mini that you really need a full, and you're trying to figure out, you're going to end up with a scar that's probably visible in the front of the back. There's no way around it. To have a notable change and be able to pull that arm up enough, you're going to have to chase it out either to the front of your body or the back of your body.
Yeah. It's got to go somewhere.
And they should have that conversation with you beforehand, Zara.
Yeah.
If you were considering that.
And the texture of the skin of the arms is a primary concern. We talk about this in our episode about alternative treatments, or the one where we talk about lasers and other kinds of things. If I think of it, Nils, I'll tell you which one it was. But specifically, the crepiness of the arms. Yeah. Skin texture after surgery is going to sometimes not be improved because the skin texture is not good to begin with.
Right.
Was it skin tightening technology?
Yes. Skin tightening technologies, because that's even after we do a full brachioplasty, sometimes the skin texture is just, on a 70-year-old woman is a 70-year-old woman's arm texture.
Which is why a full is the best option because it's going to make the texture look the best over a mini.
Yep. But still maybe not resolve it completely.
All right. Good question though.
Yeah, it was a good question. All right. Still on the same short. This
what
one is
going on?
SMD girl.
I don't think I've talked about BodyTite this much. I mean,
does BodyTite involve messing with lymph nodes?
Ain't no messing with lymph nodes.
You don't mess with the lymph nodes specifically.
You should. If you are messing with the lymph nodes with BodyTite, you definitely need to go back to BodyTite class.
Right. And because it's real hot and you're going to destroy them potentially.
Yeah.
But is it affecting your lymphatics? Yes, it absolutely is. But you're not specifically addressing the lymph nodes, nor should you be. No.
Right.
Yeah.
BodyTite is bipolar radio frequency energy. It goes from the inside and it flows through your soft tissue, through the skin to the outside. So there's really no reason to stick the filament that goes underneath your skin deep enough where it's in your lymph node basins, which those are really deep in the armpit, in the groin, the popliteal fossa, and the neck. If you are anywhere near those and you're doing BodyTite, you're doing the wrong
Yeah,
thing.
you're doing something wrong. You don't understand the anatomy. But it definitely will affect your lymphatic system for sure, because you're going to have swelling, as does any surgery. Like it affects your lymphatic system. And we talked about this. I think it was actually a question from listeners about having a brachioplasty after lymph node removal from breast cancer. And could that lead to...
That would be a problem.
Yep, to issues. And it could, yeah.
And you could even argue that BodyTite
could make that worse.
Liposuction, you know.
Yep.
So
I think we say that in that episode that anything after.
And I think that episode we talked about lymphedema, that's where it gets a little bit confusing, because lymphedema early stage is more edematous and fluid filled. Late stage is more like fibrous and fat. So in those situations, you could consider liposuction as some sort of mediation of your problems. It's not going to solve the problem, but kind of make it a little bit better.
Can debulk it a little. Yeah. So good question. All right. Same video.
Is it about BodyTite? Because I refuse to answer it.
No, it is not.
Okay.
I would like to get a fleur-de-lis 360 body lift to include an upper thigh lift. What is your experience with that and your opinion about the success?
Well, I mean, 360 degree body lift. We have body lift episodes we just did that are amazing. They work really well. Doing a fleur-de-lis, adding that on, that's a lot of surgery, a lot of surface area. But
adding on a thigh lift?
No, I haven't gotten there yet. So just adding on the fleur-de-lis alone, that's a lot.
It's a lot of incision.
So I'm not saying you couldn't do it, but you're really kind of ratcheting up. And then throwing in a thigh lift. And if you're doing a fleur-de-lis tummy tuck with a 360 degree body lift, you're not getting a mini thigh lift. I guarantee it. You're probably going to have a vertical because you've lost a lot of weight.
Even though they said they only want an upper thigh lift or a medial thigh lift.
Yeah, I mean, maybe you're that odd.
Could be. We have patients who have just real skinny legs.
Yeah, that's possible.
That have laxity.
Okay, this is go with this premise here that you're just doing the upper. You could definitely do it, but I think you're at the kind of outward edge of safety. Safety where you could do the surgery and be fine and stuff like that. But you would probably have to go to a credit institution, preferably even like a university, place that has a hospital. Maybe you get admitted overnight. That's a lot of surgery to recover from. Yeah. You could do it though. I mean, we've done cases like this. Maybe not a fleur-de-lis. The fleur-de-lis is what throws me off. Yeah. But maybe if you did a tummy tuck 360 degree body lift and a medial thigh lift, I could see doing that. Yeah. Fleur-de-lis gets a little bit complicated because that's really hard to recover from and it's real hard to heal. So you're really throwing everything in the kitchen sink at it.
Yeah, it's
which can
a
be
lot
a problem.
of incisional area.
Yeah.
Yeah. Yeah. So
you go to Turkey.
Oh, they would do it. No, they'll do anything you ask. Don't do it in Turkey. Unless that's where you live, in which case.
Turkey's awesome.
Yep.
Yeah. All right.
Yeah. All right. We're going to take a quick break. We'll be back with the rest of the questions and comments.
Okay.
And we're back. It's almost turkey time.
Yeah. That's one of your favorite times of the year.
I love Thanksgiving because it's the holiday that is all about like family and food and like no presents and you get football. Like it's so good. Yeah. Yeah. And there's candy corn and turkey. Two of my favorite things.
Yes.
All right.
We've established this on many different episodes.
Yes. Let's get back to the comments. So moving on to more brachioplasty, but now we're into episode 192. Everything you need to know about brachioplasty, part 2. I'm 63 and planning my surgery about a year or two out.
Okay.
At my age, my skin is starting to get a little crepey.
Yep.
What can I do to get my skin in better condition? And I love that Vicky is thinking ahead.
Yeah.
So there are some things that you can do with the arms. It's a big surface area. Most people are not doing like massive laser resurfacing on their arms, but something that you could definitely start doing that's easy to do at home is some just dermal rolling. Really easy to do yourself. The other thing I love for texture is dry brushing and just exfoliating. I think that's something that, when your skin is dry, you think you don't need to exfoliate, but you actually probably need to exfoliate more, and it can definitely help with that crepey appearance.
On a deeper level, doing like deep needling or Morpheus or all these things, I'm not sure that the spend on that is worth it before a brachioplasty. I would rather you do it afterwards.
Yep. Well, because then you can target it too, because right now, if you need a full brachioplasty, likely the texture of the whole arm is not great. After surgery, it'll be better in a lot of those places, but there's probably still gonna be things like specifically right around like where the arm and the body meet, like near the axilla or near your armpit. That is an area that just always kind of has that little bit of laxity in the front or right at the elbow. So saving those bigger treatments for after, I agree, Dr. Burton, is a great idea.
But what is the best thing she can do, Amy?
Lift weights.
Yeah.
Yep. because that helps build more structure underneath, and more structure.
What
is
I
what
do
we
is I
also
go
lack.
and I think, what would Nils be doing right now? Viking Nils.
He'd be like hollowing
That's
out
all
a,
Nils
a
does.
tree,
He just does curls all day long.
Yeah.
Sarah's like, come over here and work. He's like, I'm curling
curling a log.
logs with my braided hair.
Yeah.
So,
But in general, like you're so correct about that, Dr. Martin. And also on that same vein is making sure you're eating a nutrient dense diet, getting
Yep.
enough protein, all those things. If you're not giving your body the things it needs to build healthy skin, it's not going to build it. That means enough protein, enough nutrients, like eating enough. Yeah.
I want to give a shout out to Vicky Alstrom, 8589. I think she spelled crepey right. That's
I thought I did respell that.
Oh, you did?
Yes,
Okay.
because
Wow.
I could not tolerate the way it was spelled.
Okay. Well, we're just going to act like she spelled it right, because no one ever spells that word right.
They don't. I actually did correct that because I was afraid I would say it wrong if I read what they wrote. So I did. I did edit that. Yeah.
We're
Sorry.
going to brush that under the
Yep.
rug.
We'll move on to comment from Danny on episode 199, Everything You Need to Know About Lower Body Lifts Part 2. What do you mean by minimal sitting? Do you recommend red light therapy for recovery?
You talk about the sitting part.
I can talk about both these parts. Love red light therapy. Absolutely. It's going to be hard to do on some of these scars unless you have a red light therapy bed available, which looks a lot like a tanning bed.
What's the standing one that all these places have?
It's the same idea. It's just like
But there's
the
the
standing.
name of it, the brand.
Oh, there's so many. There's more than
There's
one.
one that's like pretty common. It doesn't matter.
Yeah, they're very. You
could technically stand.
Yep. And they do
Yeah.
make panels for home use that are standing panels. They are very expensive, like thousands and thousands of dollars. The little handheld ones that we like, I mean, they're literally like the diameter of the top of this cup. So to try and treat all of your scars with that at home would be really challenging. So I think for red light therapy after this, you're going to need to find a medical spa that has a red light therapy, either table that you can lay flat on or stand, the panels.
Juve is the brand.
Juve. It's actually Juve.
Whatever. It's so
Juve.
dumb. I hate these names.
But those are really expensive. Those are the ones you can get for home. Like they're crazy.
Oh, they are. They have home ones too.
Crazy expensive.
Well, they have ones that are pretty like powerful.
Oh, they are.
Having clinics and stuff.
Yeah.
Those are pretty good.
Yeah.
We've used Lightstem. We like that company. But yeah, so for sure. And then the sitting part of it for a body lift. So the reason why sitting is a problem, and Amy can get into this further, is that when you lift your knees up into a sitting position, put your hand on your back, you feel it's tighter back there. And the more you kind of flex at that joint, the more that it puts tension on the back where that body lift is.
Oh, even just flexing at the hip. I'm not even worried about the knee. Like
Yeah.
you could sit with your legs straight out and you're putting as much tension as you are with your knees bent.
Yeah.
It's the hip movement.
No, it's the hip. That's what I'm talking about.
Well,
Sorry.
you said if you bend your knee.
Well, I'm saying if you bent your knees and lifted them up towards your chest in a sitting position, you could just put your hands back and feel
Oh, right.
how
You just
tight it
bend
is.
over and feel how tight
Yeah.
it is.
That's probably the smarter thing to say.
Yeah. I mean,
was like-
I do that with people all the time. Like grab that skin
I was
when you're
imagining
standing.
Danny sitting down. I'm like, grab your knees,
No.
put your okay.
Like when people ask me how much is going to be gone, I'm like, well, because they grab like huge handfuls of skin when they're standing up. I'm like, well, you have to be able to bend over. Like bend over and touch your toes and now reach back and grab
Do you
that
have
skin.
to be able to bend over, Amy?
You do.
Okay.
The same reason you have to be able to put your arm over your head so you can put a shirt on. So minimal sitting is kind of minimal, and it's going to vary based on the type of surgery you have and
How aggressive it was.
Exactly.
It ain't no joke, man. You got
Yeah.
3 or 4 weeks where you're going to be sucking wind.
You're standing a lot.
So you're going to have to just get through it. Now, it's definitely doable. Patients do very well, and they're very happy with the results. But if you're serious about a body lift, you have to get ready.
And we had this very same conversation with a patient this week. Like if you're going to do this, you just got to deal with it and know that for a month you're going to be standing a lot and you're going to get used to it. You're going to lean a lot.
Gangsta lean.
Yep.
Yeah.
Like that's just how it is because you don't want to mess up. You don't want to go through this surgery and be like, oh, I just have to sit. Like you lean over things, you'll lean forward, you'll do a lot of things,
Your
but
step count's
you'll
gonna be
figure it
dope.
out.
Yeah, you're going to be really good.
Well, you're standing. You're gonna just get used to standing.
Yeah.
But it passes. Time passes after surgery. Before you know it, it's going to be 4-6 weeks later. You'll be sitting, and it's going to be a distant memory.
Yep.
So don't let that stop you, Danny.
Good question, Danny.
All right, back to brachioplasty. We're just going top to bottom.
I mean, Jaybird Health Spirit?
Well, so if you listened to episode 200, which was our 200th episode, we listened to Dr. Martin's favorite clip of the podcast, which just so happened to be when I was saying disparaging things about his comment about arms swelling with menstrual cycles.
Yes.
And this is what this comment addresses. So this was from episode 143 on brachioplasty myths. She said, I get puffy. I'm sure my bat wings puff up too. Hey, be kind to all experiences. So fair enough, Jaybird.
There you go.
Thank you, Jaybird.
More my point was that your uterus potentially isn't what's causing your arms to swell, but if you have inflammation in your body, it can happen anywhere.
Yeah.
And I do agree.
Yeah.
So
you're
I'm
right,
sorry I said disparaging things about your uterus.
No,
making
but
your
she's
arms
right.
swell.
She
is
right.
right.
She's right.
Yeah. That's why I put this comment up here,
Yeah.
because you're right.
You're
like
right,
I am
Jaybird.
not that person who's going to be like, I'm not going to put this comment up because I was wrong. Like
Yeah.
I'm
Right.
absolutely like you can have swelling anywhere.
Yeah, you definitely, if you're
Yes.
a swelling kind of person, it could be your arms, legs, your feet, your hands, for sure.
Yeah. And it can be unrelated to your menstrual cycle. It can be related to your menstrual cycle. It could be anytime.
Right.
So
That was the
yes.
point you were making, that it's not just because of you have a uterus.
Right.
That's what you were
That
saying.
was more my
It
point.
just came out very body and kind of direct,
It did. And I apologize.
which I would never do.
So thank you, Jaybird.
Dr. Strange would
I
not do
appreciate
that.
you commenting. I really do. So
Yeah, thank you, Jaybird.
All right. Moving on to body lifts again. Everything you need to know about body lifts, part 1. This is from Celeste. I had a circumferential lower body lift with abdominoplasty following a 180-pound weight loss. Amazing.
Ooh, nice.
Amazing. The results were jaw-dropping, truly incredible. The biggest transformation for me, however, was in my self-perception.
Yes.
Before my lift, I saw myself as someone who was seriously overweight because I had so much loose skin. Since my surgery, I have a total mind shift and now see myself as I am.
Can we
now.
just put this on a t-shirt?
I love this.
I mean, I am super fired up. Celeste, Aborin 3366, you go. This
And
is awesome.
I commented back to her, like, thank you so much for sharing your experience. And a couple of people asked her some questions and she continued to comment in the comments, which I so appreciate because, you know, not only the information that we give, but like, I do want people to feel like they have a place to go to get real information.
Right.
And so many go to the weird side of Reddit or Real Self and get terrible information.
So there was a patient I had recently that came, it was up there, came into clinic.
in the heavens.
Yeah, in the heavens. And
Was this like,
yeah,
was
it's
this God
in the mountains.
surgery?
It was in the mountains. And she said, she came from somewhere else. She found us through Reddit. And actually, according to her, the Reddit thread was really helpful. And they shared a common document
Oh, wow.
about their experiences with the surgery, with the surgeon.
Was this for breast surgery?
Yeah. With the staff and the outcomes and how they overall feel. And I felt like that was so powerful. I was so intrigued. Like, where is this mystical document? Thank God most people don't know about it because all these surgeons would go in there and mess with it and try to make them sound better. But I love the fact that she got a lot of value out of that.
Yeah.
And she literally came to us for that reason, just from the Reddit thread.
Which is really cool. And like there is something great about the internet's ability to bring people together.
Yeah.
You know, who have shared experiences, especially with something like breast cancer.
Right.
You know, like that's especially with
Breast
those
cancer,
situations.
breast reduction, things that are
Yeah.
more medically oriented.
Yeah.
And she said this document was international too. So
Interesting.
it was not just in America.
Wow. This is interesting.
Yeah, I don't know.
Dr. Strange.
Yeah.
You're affecting the whole world.
Watch out, people.
Yeah.
I'm on Reddit. I'm on weird Reddit.
You're on good Reddit. But no,
I'm on every Reddit.
I appreciated this comment so much, Celeste.
Yeah.
And congratulations.
Yeah, you're awesome.
And it is true. Like even when you lose a lot of weight, like you cannot see your whole self because of the skin.
Yeah.
So yeah, I mean, and I doubt she regrets any one of her scars.
I don't regret it for her.
Yeah.
Yeah.
So yeah. All right. Now a fun one. Stuff we're into. This is from Patty Dibb. Wow, this was enlightening. I really liked the breathing conversation. Also, I remember playing a version of this game at Halloween parties, except you'd stick your hand in a bag and feel grapes, and then you'd scream because you were told they were eyeballs. LOL, fun times.
So in our grade school, Dunn Elementary, Louisville, Kentucky, at Halloween, we would go in the library and the librarian would have the lights down and bags you would stick your hand in. And each bag was like brains or
Right.
yeah, that kind of
The
stuff.
eyeballs.
Right. What the brains was like, I remember one of them was like your insides of your stomach.
Intestines.
And it was like
Oh.
spaghetti.
Oh, yeah. I love that. Yep.
They could never do that now because the PTA would be so angry with it, but it was so awesome back then.
All right.
Oh, that would be fun. I love, those are some of my favorite episodes. And I did emphasize a lot on our most recent one that everything in mine was clean because there was something that, you know, was inserted inside the body. And I didn't want you to throw it when I told you what it was.
You're right, exactly.
So yeah, we appreciate that you watched that one, Patty. We love those episodes.
Yeah.
They're some of our favorites. All right. So this was in our episode. This is from Vicky, episode 180, Reddit response to tummy tucks. Here we go into Reddit. She said, Ari Payne with lipo. I cringe while watching videos of lipo being performed. It looks so violent. No wonder it hurts. People say that to me a lot because they watch videos like, wow, it looks really aggressive. I'm like, well,
it's controlled aggression.
That fight doesn't want to go.
It's controlled. It's not like,
it's not aggressive.
It's not actually violent. It's just, there's strength involved.
Well, and I think people are somewhat surprised by the quickness of the movements. You know, I think that's what gets them more is like the speed of movement with lipo.
Yeah.
You know, because it does seem like you're just like maybe haphazardly kind of doing it, which you're not. But you do want to keep it moving because if you don't, you know, there's suction happening at the same time.
Right. You'll get contour deformities and also just by action of the movement, you're running through the soft tissue you want to suck out. So you're exposing the tip of that cannula to more surface area. And then you have your hand on the outside pushing down, so you're compressing it in. So it's kind of like a whittling motion, basically. So you don't whittle. I mean, you can like super slow like this, but you usually whittle like this. And
like, like grate a carrot.
Right. So, and then also that movement is done in kind of a planar fashion, like this, if you're watching the video. So you're visually adjusting the whole time. So it's actually coordinated. It's not just a violent movement. It's actually very it's one of the more coordinated things we do from a proprioception standpoint.
Yeah, you gotta be paying attention because on some cannulas, like it's suctioning from the second you put it in.
Yeah.
We have cannulas where you can allow the suction to come off and leave the cannula in place, but most cannulas aren't like that. So like you need to be focused.
Yeah.
Yep. It's not so much violent as it is. I think it's just really focused.
Yeah.
But yeah, it does hurt. Yeah.
Yeah, watching you know, when we do the trainings and stuff, we're watching you do it in person. It reminds me more like someone who's really good at a craft. You know, like when you watch someone do something on YouTube, like pottery or something like that, and they move fast and, you know, but then like the thing that they're doing like just becomes perfect in front. You know what I mean? It's like ASMR for like visual. Right?
I watched a Japanese guy, and he was definitely Japanese, make a Japanese teapot.
Yes.
From clay.
Wow.
And he was moving so fast.
Yeah.
And it was such a delicate process. So you could say he's moving aggressively.
Yeah.
And it was compressed video. You know, it was probably an hour or 2 hour process. It was compressed down to 5 minutes, but it was amazing.
But it is, it's like, like the speed of it and the consistency of it is what makes it like really smooth. Like people who make cool candy and stuff like that, it kind of reminds me of that because it's like it needs to be that repetitive smooth,
motion.
But it also can't be, you know, like you said, like whittling. It wouldn't be slow and gentle. Wouldn't get the wouldn't work. Yeah. So it's very cool to watch.
Yeah. So, then it does hurt. All right. So from our episode 197, Reddit response liposuction, this is from Karen Wilson. Why didn't I have leakage from lipo? Even my tummy tuck didn't leak. They had a drainless tummy tuck, which if you were leaking with a drainless tummy tuck, that would not be okay. That would mean your incision itself was leaking. Yeah. So I wrote back.
Every now and then we have people that don't leak from lipo for sure. And then you definitely have tummy tucks with drains or without that you could, like if they have drains, you pull it out really early.
Yeah, because they're just not putting out much fluid. It's very person dependent. And I always tell people that after surgery because I don't want them to be worried that if they're not leaking that they should be. But the juice box comment is legit as well. Like we have patients who stand up off the table and they're literally shooting fluid across the room. So a lot of it just has to do with you. Like how quickly your body absorbs that fluid.
The technique, how much tumescent fluid was used. I mean, the duration of the surgery. Yeah. You know, you could have, if you did your tummy tuck asleep, which you probably did, you probably were leaking when you got done with the case and they cleaned you all up and you woke up an hour later and you feel like you're all dry and there's nothing going on, right? But it just, it's, I don't know, but it's totally fine. It's totally normal. So.
Yeah, not either one is good or bad. Like you're going to leak the amount you need to leak from your lipo. If you don't leak any, like that's okay.
We're pro leak. We're pro no leak.
Yeah.
If you're kind of leaking, we're down with it.
Yeah. All right. That brings us to the end of what I feel like was a very limb-heavy questions from listeners.
Body lifts, BodyTites, and
mostly arms and legs.
Arms and legs.
Yes, you guys were big on the limbs, the extremities. Yes. It was an extremity-filled couple of episodes.
Right. We need some face stuff coming up.
And some weird comments. And we love all the comments. I mean, even when we're wrong. So thank you, Jay Bird, for sharing your experience with puffy arms, or puffy bat wings, as she said.
Yep.
Her bat wings puff up. So if you would like to be featured on the next listener questions and comments, leave us a question or a comment.
Right.
You can find us on all social media at Jason Martin MD and at Beauty and the Surgeon Podcast. And you can also send me a text or leave me a voicemail at 303-630-9038. You got any wrap-ups?
No, I just love listener questions. I feel like I could do 12 of these.
Well, we do them frequently, and I love it. I saved a bunch of these just because, we had a bunch that kind of just came up all at once. So some of them were from June, and now it is October. So all those people, I do tell them. So when we do these, I go back and I tell everyone that that their comment is coming up.
Oh, that's good. That's fun.
Yeah,
that is fun.
Yeah. So until next time, it's going to be turkey time when we see you next in November.
Yes, I'm going to be tired. I'm going to be lazy.
It'll be November 1st.
Stuffed.
It'll be November 1st. So
I'm going to be ready to go.
You'd be none of those things.
Oh, okay. Never mind.
Yeah, you'll be none of those things.
I'm going to be ready to go.
Yeah.
Oh, that's what I'm saying.
That's true.
What day is this?
You'll be all candied out. You'll be like in a little diabetic
Where
coma
are we?
in the corner. All right. We will see you all here next time.
Bye-bye.